Welcome to Rerzeh, your ultimate health and wellness guide. Understanding ulcers, symptoms, treatment, diagnosis, and prevention. Ulcers are a common but serious medical condition that affects millions of people worldwide. Many people mistakenly believe that ulcers are simply caused by stress or spicy food, but the truth is more complex. Ulcers are painful sores that develop in the lining of the stomach, small intestine, or esophagus due to an imbalance between stomach acid and the protective lining of the digestive tract. Without proper treatment, ulcers can worsen over time and lead to serious complications like internal bleeding, infection, or even perforation of the stomach wall. So what exactly causes ulcers? What are the symptoms? And most importantly, how can you treat and prevent them? In this video, we'll go deep into everything you need to know about ulcers, their symptoms, treatments, medications, and lifestyle habits to avoid if you are an ulcer patient. Let's dive in. An ulcer is essentially a wound in the digestive tract caused by excessive stomach acid or a bacterial infection. There are several types of ulcers, but the most common ones include peptic ulcers, a general term for ulcers that form in the stomach or small intestine. Gastric ulcers, ulcers that develop in the stomach lining. Duodenal ulcers, ulcers that appear in the first part of the small intestine, called the duodenum. Esophageal ulcers, ulcers that form in the esophagus due to acid reflux. Each of these ulcers can be painful and disruptive to daily life. If left untreated, they can lead to severe complications like stomach bleeding or perforation, which is a life-threatening condition. Ulcers don't always show symptoms right away, but when they do, they can cause significant discomfort. The most common symptoms include burning stomach pain. This pain is usually worse on an empty stomach and improves after eating or taking antacids. Bloating and feeling full quickly, frequent burping or acid reflux, heartburn and indigestion, nausea and vomiting, unexplained weight loss, dark or tarry stools, a sign of internal bleeding, vomiting blood or coffee ground-like material. These symptoms may start off mild but can worsen if left untreated. If you notice blood in your vomit or stool, seek immediate medical attention, as this could indicate internal bleeding. Ulcers are not always caused by stress or spicy food as many people believe. Instead, they are usually the result of two main factors: Helicobacter pylori or H. pylori bacteria. H. pylori is a bacteria that damages the protective lining of the stomach, allowing acid to create ulcers. It is estimated that nearly half of the world's population carries this bacteria, but not everyone develops an ulcer. Overuse of NSAIDs or non-steroidal anti-inflammatory drugs. Pain relievers can irritate the stomach lining when taken frequently, leading to ulcers. Other factors that increase the risk of ulcers include smoking, reduces the stomach's ability to heal itself. Alcohol consumption increases stomach acid and irritates the lining. High stress levels. While stress doesn't directly cause ulcers, it can make symptoms worse. Spicy foods. These can aggravate symptoms, but they don't directly cause ulcers. Family history genetics can also play a role in the development of ulcers. If you suspect an ulcer, your doctor may recommend one or more tests to confirm the diagnosis. Endoscopy. A tiny camera is inserted through the throat to examine the stomach and intestines. H. pylori test. A breath, stool, or blood test can detect H. pylori infection. Barium X-ray, upper GI series. A special liquid is swallowed to help visualize ulcers in an X-ray. Early diagnosis is crucial for effective treatment and prevention of complications. Biopsy. A small tissue sample may be taken during an endoscopy to check for cancerous cells. Ulcers can be treated and healed with the right medications and lifestyle changes. The main treatment options include medications for ulcers. Antibiotics, used to treat H. pylori infection like amoxicillin, clarithromycin, and metronidazole. Proton pump inhibitors, PPIs, reduce stomach acid such as omeprazole and pantoprazole. H2 receptor blockers, decrease acid production, for example, ranitidine and famotidine. Antacids, provide quick relief by neutralizing stomach acid. Cytoprotective agents, protect the stomach lining, including sucralfate and misoprostol. It's essential to complete the full course of antibiotics to ensure the H. pylori bacteria is completely eliminated. Lifestyle changes for healing are also important. Eat smaller, frequent meals to avoid excessive stomach acid buildup. Quit smoking and reduce alcohol consumption. Manage stress through relaxation techniques like meditation or deep breathing. Stay hydrated and drink plenty of water. Limit caffeine intake as it can worsen acid production. Taking preventive steps can reduce the risk of developing ulcers and prevent them from coming back. Avoid overuse of NSAIDs. Take NSAIDs with food to reduce stomach irritation. Maintain a healthy diet by eating a balanced diet rich in fruits, vegetables, and fiber. Avoid spicy, acidic, and fried foods. Practice good hygiene by washing hands regularly to prevent H. pylori infection and avoid sharing eating utensils or drinks. Reduce stress by engaging in stress-reducing activities like yoga, walking, or listening to music. Get enough sleep to help the body heal. Stay hydrated by drinking plenty of water. Certain foods can worsen ulcer symptoms. Avoid spicy foods, caffeinated drinks like coffee, tea, and soda, alcohol and carbonated beverages, citrus fruits, tomato-based products, and fried foods. Instead, opt for lean proteins like chicken, fish, and tofu, whole grains such as oatmeal and brown rice, low-fat dairy products, non-citrus fruits, and vegetables. Seek immediate medical attention if you experience severe stomach pain, bloody stools or black, tarry stools, vomiting blood or dark-colored vomit, or unexplained weight loss. It's crucial to see a doctor as soon as you detect symptoms related to an ulcer, as early diagnosis and treatment can help prevent complications and promote faster recovery. Here are some key reasons why seeing a doctor is important. Accurate diagnosis. The symptoms of ulcers, like stomach pain, bloating, nausea, or indigestion, can overlap with other gastrointestinal conditions. A doctor can properly diagnose whether the symptoms are indeed caused by an ulcer and determine the underlying cause, such as bacterial infection, Helicobacter pylori, excessive use of NSAIDs, or stress. Effective treatment. A healthcare professional can prescribe medications that reduce stomach acid, protect the stomach lining, or address bacterial infections. This treatment can help heal the ulcer, relieve symptoms, and prevent the condition from worsening. Long-term management. If you have recurring ulcers, a doctor can help manage and minimize risk factors, such as adjusting medication regimens, recommending lifestyle changes like dietary adjustments or stress management, and monitoring for any signs of recurrence. Peace of mind. Seeing a doctor can provide reassurance. It's important to understand the cause of your symptoms and how to manage them properly, which can ease anxiety and allow you to take proactive steps toward your health. In summary, consulting a doctor when you notice symptoms of an ulcer is essential for proper diagnosis, effective treatment, and avoiding dangerous complications. Ignoring ulcers can lead to serious complications, including stomach perforation and even stomach cancer. Ulcers can be painful, but they are treatable with proper medication, lifestyle changes, and early diagnosis. If you experience symptoms, don't ignore them. Seek medical attention as soon as possible. By eating a healthy diet, managing stress, avoiding harmful foods, and taking prescribed medications, you can prevent ulcers and maintain a healthy digestive system. Have you or someone you know struggled with ulcers? Share your experience in the comments below. If you enjoyed this video, hit that like button, subscribe, and turn on notifications so you never miss a new video. Thanks for watching, and I'll see you in the next video.